Engineers at the University of California, San Diego have developed a soft, stretchy skin patch that can be worn on the neck to continuously track blood pressure and heart rate while measuring the various levels of glucose as well as lactate, alcohol, or caffeine. It is the first wearable device that monitors cardiovascular signals and multiple biochemical levels in the human body at the same time. This type of wearable would be helpful for people with underlying medical conditions to monitor their own health on a regular basis. The study is published in the journal Nature Biomedical Engineering. It would also serve as a great tool for remote patient monitoring, especially during the COVID-19 pandemic when people are minimizing in-person visits to the clinic. Such a device could benefit individuals managing high blood pressure and diabetes, individuals who are also at high risk of becoming seriously ill with COVID-19. It could also be used to detect the onset of sepsis, which is characterized by a sudden drop in blood pressure accompanied by a rapid rise in lactate level. One soft skin patch that can do it all would also offer a convenient alternative for patients with intensive care units, including infants in the NICU, who need continuous monitoring of blood pressure and other vital signs. These procedures currently involve inserting catheters deep inside patients' arteries and tethering patients to multiple hospital monitors. The patch is a thin sheet of stretchy polymers that can conform to the skin. It is equipped with a blood pressure sensor and two chemical sensors, one that measures levels of lactate, caffeine, and alcohol in sweat, and another that measures glucose levels in interstitial fluid. The patch is capable of measuring three parameters at once, one from each sensor: blood pressure, glucose, and either lactate, alcohol, or caffeine. The blood pressure sensor sits near the center of the patch. It consists of a set of small ultrasound transducers that are welded to the patch by a conductive ink. A voltage applied to the transducers causes them to send ultrasound waves into the body. When the ultrasound waves bounce off an artery, the sensor detects the echoes and translates the signals into a blood pressure reading. The chemical sensors are two electrodes that are screen printed on the patch from conductive ink. The electrode that senses lactate, caffeine, and alcohol is printed on the right side of the patch. It works by releasing a drug called pilocarpine into the skin to induce sweat and detecting the chemical substances in the sweat. The other electrode, which senses glucose, is printed on the left side. It works by passing a mild electrical current through the skin to release interstitial fluid and measuring the glucose in that fluid. The researchers were interested in measuring these particular biomarkers because they impact blood pressure. The combination of the sensors helps to judge whether any sudden spike in blood pressure is due to an intake of alcohol or caffeine. In tests, subjects wore the patch on the neck while performing various combinations of many tasks: exercising on a stationary bicycle, eating a high sugar meal, drinking an alcoholic beverage, and drinking a caffeinated beverage. Measurements from the patch closely matched those collected by commercial monitoring devices such as a blood pressure cuff, blood lactate meter, glucometer, and breathalyzer. Measurements of the various caffeine levels were verified with measurements of sweat samples in the lab spiked with caffeine. One of the biggest challenges in making the patch was eliminating the interference between the sensors signals. To do this, the researchers had to figure out the optimal spacing between the blood pressure sensor and the chemical sensors. They found that 1 centimeter of spacing did the trick while keeping the device as small as possible. The researchers also had to figure out how to physically shield the chemical sensors from the blood pressure sensor, which normally comes equipped with a liquid ultrasound gel in order to produce clear readings. But the chemical sensors are also equipped with their own hydrogels. And the problem is that if any liquid gel from the blood pressure sensor flows out and makes contact with the other gels, it will cause interference between the sensors. So instead, the researchers used a solid ultrasound gel which they found works as well as the liquid version but without the leakage. Ongoing work includes shrinking the electronics for the blood pressure sensor. Right now, the sensor needs to be connected to a power source and a benchtop machine to display its readings. The ultimate goal is to put these all on the patch and make everything wireless.